Oftentimes, patients do see me for consultation without quite knowing all of the information yet. They might have a breast MRI pending or their genetic testing pending. And so those results can influence their decision with, what they want versus, a unilateral versus a bilateral or a lumpectomy or conservation therapy versus, a full mastectomy. So we usually talk through all of those options, but I do tell them by the time of the pre-op appointment, which is about 2 weeks before the surgery, I do need to know what we're doing so that I can order supplies accordingly. But typically by the pre-op, they have all of that information. But these patients, a lot of information is thrown at them so quickly. We want to make sure that we're dealing with their cancer, and so they're not just meeting with their breast surgeon. They might be meeting with a medical oncologist, a radiation oncologist, the plastic surgeon. The nice thing about my breast surgeons is they, reconstruction is always going to be an option for them. So they always talk about their reconstructive options and put them into my care, my office to talk about all their reconstructive options, the pros and cons of all of the different routes. But a lot of information is thrown at these patients very quickly. And we're expecting answers from them. And I do think that our job is just to, listen and tell them what their options are and, make sure that they're making an autonomous decision for themselves in their, reconstructive journey. I never want to feel like I'm leading the conversation one way or the other. I don't want to feel like I'm swaying a patient into making a decision. And so that is why, it's nice to sit down. Our consultations are an hour. Sometimes I have follow-up phone calls with patients that they have more questions. There is a lot of information to take in and that can influence these decisions for patients.